My name is Ali Barra Falisano. I'm a staff of LMAT Specialist Hospital.
My name is Matthew Anyang. A consultant obstetrician and gynecologist, the founder of LMAT Specialist Hospital, the fertility center in the Gambia.
My name is Alaji Singate. I work with LMAT Specialist Hospital as the laboratory manager. I have bachelor's in medical laboratory science with diploma and certificate in medical lab science. I have over 13 years of working experience in the lab.
Hello, I am Nurse Tuti from LMAT Specialist Hospital, IVF nurse.
We are here to welcome patients whenever they're here to see a doctor. We answer their questions and also make them feel comfortable whenever they're around. Yeah, we also give them details about the stuff that they want to know, because some patient comes here not to just see a patient, but to make inquiries about the hospital and what they do. So we're here to make them feel comfortable and basically, and make the atmosphere very lively for them. I've been working at LMAT for 4 years now, and it has been a great experience because I've learned a lot within the 4 years that I'm here. We do have a system, as you see. That's where we save most of our patients' files, and we also have a registrar book that we keep contacts of every patient that comes here. In case the system is down, we can check on the books or check on the system in case if there's any file that's missing. That's where we retrieve all the patient's files, then whatever missing thing that is there, we get it from the system. The steps that we take to make sure that the patient's files are well confidentially saved and it doesn't have to go to anybody is by, like I said, it's from the reception to the doctor directly. So whatever details that we stored, no one can see it, just the doctor himself. So that is to show that every patient's file or details is totally confidential and it doesn't get to anybody, or no one knows about their medical history or whatsoever it is, since it's confidential.
IVF, we do IUI, we do time intercourse, and also we do a lot of fertility preserving surgeries in the gynecology area. Provided your age is within the regulation or policy age of fertility, so we'll be able to reconstruct whatever problems you have in your reproductive system to enable it to carry babies. So we do all of that here. By extension, we do other things regarding general care of families. Babies are born here, they have the immunization here, and the public health officers working with us every Saturday to immunize the babies. And we have our labor ward, the theater for general surgeries of any sort. We have general surgeons that come and do surgery here. Urologists also come from time to time. Most of the things we do in infertility as well. Some men actually we need urologist review and maybe sperm collection from the testes or around the testes. So we do all of that here, and so far so good with our success rates always maintained, and we hope to maintain it more and keep the flag flying. For now, we'll go into that in more details later regarding what we have done in IVF so far in the Gambia.
In vitro fertilization, IVF, after 2 weeks of embryo transfer, we usually do pregnancy tests for our patients. Okay, the pregnancy test that we normally do here is called beta-HCG. Beta-HCG, usually we normally collect their blood and send it to the lab for the lab technician to conduct the test.
The hormonal machine, it is an eye chroma 2, which we more normally use to do screening for hormonal tests for infertility patients, both for male and female patients. These are the reagents that we normally used. Besides are the yellow tips, this is the pipettes and the eye chroma incubation chamber. Right now, I have a patient which I need to run an hormonal test. Now, when this 15 minutes elapse, we will just read the sample and we have our results. After all, if you follow after what all the steps I was doing, I was just been following these things. These are SOPs, and these are the things that if you follow in the lab, all the results that you generate will be of quality, and this has paid a good dividends in our IVF patients that we recorded. The first batch we have recorded over 70% success rate. All of this because the lab is playing a good part with quality laboratory results generated on every patient. Following SOP from sample collection up to transportation, testing, recording of results in the book, all of them are just accurate. So with this, we cannot achieve this thing without the support of our CEO. He makes sure everything that we need in the lab, it is available. All the reagents we need, whenever I knock in his door, he makes sure that he will give me a check to go and get it. And I, being the supervisor, I record everything when I receive them. I have a quiet book, which I record all the items that I received and dated it for proper inventory of lab items and to help me to not to run out of shortage of any test kit. That is not an issue happening in LMR specific hospital anymore. We are generating quality resource and we are managing our resource wisely. And patients are happy with the customer service that we give to them.
IUI is intra-uterine insemination, a situation whereby the reproductive system of the woman is working well. She has the fallopian tubes, she has the uterus, she has the ovaries that can be made to work better. The sperm is also normal. Yes, I'm sure some people that joined us some 2-3 years ago when we started here, we are doing a lot of IVF, then we never IUI. Then our IVF establishment have not really come in place in the Gambia. We still do, people travel and come back, but now everything is done here for IVF, so nobody travels again. Regarding the IUI we are doing then, special installation was an issue because we offer what we have. Then was the IUI was offered to many couple whose semen parameters were not really optimal. We are hoping that by sperm wash and sperm preparation, which we do, we should be able to enable any of the sperm we can get to really fertilize naturally in the womb and also in the fallopian tubes. But unfortunately, many of them did not work, which made us to work harder to have IVF. And also we have stopped that more or less, except those that the semen is absolutely normal. We have a good number of the semen in the grade A region, whereby the motility is very good, and then the sperm quantity as well. So we don't offer IUI for those ones who perhaps for other reasons they wouldn't want to go for IVF for now, and the cause of their fertility is unexplained or unknown. Perhaps is also willing to see conception happen in her womb, not outside the womb. So the age-wise, is for female, that's age-related fertility rate.
There are limitations on the number of times couples can try IVF, depending on several factors. Factors are financially, because IVF is expensive, and then if they are financially capable, they can go as much as possible. Some are saying 2 to 6 cycles, some are saying 3 to 6 cycles. It depends on the capability. That is number 1. 2 is the well-being of the couples, how they are healthy, their health condition is. 3, their age matters. Age factors matters too. Yeah, those are the things that can permit someone to do more trials. If they are financially stable, if the age is permittable, and then if also their health permits, they can go as much as possible. Until the only time people can say IVF is successful is when you have a take-home baby. But IVF, you can try as much as possible until you see the final results, which is having pregnancy and also take-home babies.
We have our own research based on our own practice. Any woman above 34 years, as we discovered in our study here, their ovarian function is really not too good, and there's a massive ovarian reserve depletion on women that are well in advanced 30s, 38, 39, 40, and then going to 40 years. Their ovarian function is really not too good. We do ovarian reserve test, AMH, we do it here, we do AFC. AFC is intrafollicular count by tracking the follicles. When we do that, we discover that they are not really doing well. So when the ovaries cannot be stimulated sufficiently enough to have good follicles at the end, it's always difficult to offer IUI to such people. If they can afford IVF, it's good to do IVF. But we see a situation whereby finance is a problem here. Many of them would want to try IUI because their fallopian tubes are working, the semen is fine. Even though their age is 42, 43, they are insisting to do IUI. But truly speaking, age above 35, the ovarian function may not be optimal, even though we have medication to help. But so far, the medication we give to stimulate the ovaries does not give absolute good results. Yes, so we believe going for IVF at that advanced age due to ovarian function depletion is one way out to give hope to people that have such problems. But cardinally, we have 2 main reasons for doing IVF, or 3, for women in this sub-region, particularly in the Gambia now. The leading is the male factor, which I said we are no more offering IUI for all male factor infertility. We stop that because the success rate is very low, absolutely low. I can say maybe let's say I did 10, only 1 got pregnant, so it's less than 10%, and third pregnancy even had a miscarriage. So just rough statistics if you do it that way, but I'm sure there are more than 10. Perhaps we did up to 20. I didn't bother checking, and maybe only 1 I can remember got pregnant from IUI. So it was not a good one for us because of the selection of the patient. Then the semen was really not too good, but we're just hoping that perhaps working on the semen, they probably will have a chance of conception. But that did not happen. So we offer IVF now for all male factor infertility, no matter what grade you are in male factor infertility. We have the solution here. Why? We have the ICSI machine. ICSI is intracytoplasmic sperm injection. We have the latest version of it here in the Gambia. It's called the Beast. So we have it, and it works so well that it can select the only one good sperm the man perhaps has to use to fertilize the egg of the wife. So we have ICSI machine here, and we do a lot of ICSI on all the cases we have done. We have fertilized here many of the fertilization. We've done over 43 cycles, and we've done fertilization to so many of them, and each time ICSI, 98% of all of them were through ICSI fertilization, and the embryos will be cultured, cryopreserved before embryo transfer. We do frozen embryo transfer here because of the success rate attached to the frozen embryo transfers. So we are not surprised at our rates. We have 50 to 60% success rates, counting of the last 4 batches of IVF embryo transfers we have done in the Gambia. So we have cumulatively about 50 to 60% success rate. Some of them have delivered twins, singleton, and we have their pictures displayed at the reception hall. So we've got to that level. The weight of experience is increased naturally from doing simple stimulation. I start doing simple stimulation.
Unless if you want to do surrogate, if you need to do surrogate, and surrogacy also is available here. So if anyone is interested on surrogacy, knowing your age or our delimitation of the age, you can come and do your surrogacy here. Pregnancy test can be usually performed after 2 weeks of embryo transfer. IVF birth defects, it's more higher compared to the normal birth conception.
The first embryo transfer was done 13th April 2024 in this Gambia, 9th to 13th April. And then about 9 people were, 9 women had embryo transferred, and out of the 9, 6 of them got pregnant, and we had 1 miscarriage, and the 5 have all delivered. Now we did a second embryo transfer in August, where 12 of them did embryo transfer, and 6 got pregnant out of the 12. And pregnancy is ongoing now, even though we had a few of them had miscarriages, but about 2 of them are still having ongoing pregnancy as we speak. Then we did another embryo transfer in December 2024 now, where we had 14 people had embryo transferred. Out of these 14 people, 6 of them got pregnant, and all of the 6 are ongoing, no miscarriage as yet. So when you calculate, put the figures together, you will see that we have done embryo transfers on 14, 12, and 9. That's about 26 plus 9. We are looking at 30. 26 plus 30 is 35 embryo transfers, and 18 of them got pregnant. So statistically, it's about 51% pregnancy rate we have now speaking. So we believe that we have seen the beauty of IVF. We have seen joy and smiles and happiness in homes. We have seen marriages that are on the verge of collapse come back to life. We have seen hope given where hope seems to be lost. We have seen a woman that have been kind of written out that she will not ever be pregnant because of age factor. She was able to be pregnant, so everybody saw, and she got her baby delivered as well. Many are still coming. We are badging, and so far for this particular batch for March, April, over 40 couples are in this batch. So we are having an enormous number coming, and we are equal to the tax here. Yeah, I believe everybody would be glad to really want to see what we are doing, and the doors are open. We'll take you around if you come. And then what is interesting now is people coming from everywhere from America, from UK, from the Scandinavian countries coming to do IVF here is what is really giving us that courage to continue to do the best we can, because for many reasons they chose to come to the Gambia to do their IVF. So we are working hard to make sure the standard remains or even higher at this rate we are going, and the statistics we have and the success rate we are quoting is being seen as in comparison with any other good center anywhere in the world. So with that is a big courage for us. With that is a big motivation, and we hope that we'll maintain the standard and even do more on the standard, with all the stakeholders coming together to give us the support we deserve, and then we together we build a regulated fertility treatment in the Gambia.
We first acknowledge and listen, that is calmly listen to the patient's complaints, and then later on we clarify and give apologies if there's any missed appointments that have been given on our end. We also try to verify details, that is check appointment records to confirm that we give a correct appointment date for them to come to the hospital. We are here to register patients, welcome them, and make them feel comfortable. We also started a massage treatment that will be taking place here every Saturday at LMR Specialist Hospital, because it's a new progress. We're going bit by bit. Yeah, so we're 4 years now, so we just want to say thank you to every patient that has made our journey very nice and smoothly over the years, and we're expecting to get more patients as well. So there are more things in store for each and everyone that will be coming here. And also we do have our social media handles. If for those people that want to get us, reach out to us, we have Facebook, we have Instagram, we have TikTok and WhatsApp, via WhatsApp too.
The idea is not about money, but it's about quality service, trying to get the quality materials, solutions, media, the expertise, the quality drugs to do it and do it well. So it's not cheap. All those medications are ordered and they are paid in dollars, and dollar is always going higher when you compare with local currencies anywhere in the sub-region. So we are having that challenge of affordability of the IVF. It's available, it's accessible, but affordability has been an issue, and a few of them that can afford it. And what is driving and pushing them to continue to make effort to afford to do their cycles is because they are seeing the sources. Their colleagues are getting pregnant, they are seeing their colleagues delivered, they are seeing their neighbors, they became friends as they come here. So that, I believe, is the motivation they have to see how they will keep pushing to finish a cycle or do a second cycle if the first one did not work well. So we are hoping that even though as we do second cycle or even third cycle, the fee is reduced, the money drastically reduced for them, over 40-something% discount from the first fee payment to second fee and third fee payment. The person we have seen that have gone into third cycle, she's having twins in her womb. Only one person. The rest are in their second cycle and they got pregnant in the second cycle. The only one that have gone up to the third cycle, first one she did not get pregnant, second cycle she had a miscarriage, and third cycle she's having twins now as we speak.
Give a little bit about LMATs. So for people that have been struggling with, getting pregnant or infertility, here is your one-stop place for all your treatments. Like, yeah, by the grace of God, you will get pregnant when you are here, whatsoever problem that you have when it comes to infertility. You can come here at Elements. We do IVF, we do IUI, we do a lot of things here basically. So Elements welcomes everyone that has problem with infertility or whatever it may be. You can reach us on our social media platforms on TikTok, Instagram, and Facebook on www.esh.gm, that's elementspecialisthospital.com. And also you can reach us on WhatsApp, that is 297-8350, 297-8350. You can also reach us on our other telephone number on 778-6700, 778-6700. Yeah, so thank you all.
We work with experience that this one we are using works. And what is in the supplements, some of them are vitamins. What I will share is that those vitamins, the ones we recommend, actually the dosage is quite high. Maybe that's why they tend to work within a short time to help, which I'm not sure about. But we give a very high dose of those medications in terms of supplement, like vitamin E, for example. The brand people can have around could be 400 microgram, 200 international units, and all of that. So we have a certain brand that is 1,000 international units in one capsule. So it's a rare brand, and we believe it also helps the endometrium. The endometrium is the inner lining of the womb for embryo implantation. Maybe helps, we cannot say for sure. Food-wise, there is no food that is contraindicated, in terms of preparing for embryo transfer, except at the end of embryo transfer, one can advise that people should avoid taking extremely hot meals, extremely spicy food that is too pepperish. Just advice to avoid discomfort generally, because we wouldn't want to add discomfort to already a woman who is anxious, stressed already from the whole program, hoping that she will be pregnant. So we wouldn't want them to go be in any form of stress, and we tend to avoid giving them all those medications, that those food items that probably affect them. We don't want them to eat such spicy food. Alcohol, smoking, extreme attire cooking, too much of coffee or coffee consumption, all those ones actually from evidence-based should actually be avoided. Should be avoided for any woman who wants to conceive and go smoothly through the conception. It's good to avoid those minerals, beverages of such. We should avoid those ones. But normal food is fine. Nobody says you should not eat a normal food, but don't make it too spicy. Don't make it too spicy. Reduce your salt and pepper intakes, and that is what we can advise them regarding that. Generally, supplement helps, and we know when to start the supplement, to stop it as well, so that we don't want any interference with the pregnancy. So we regulate the use of supplements a lot for mothers here, and we will not say people should not use it, but we say they should use it if you can afford it. It's not part of the IVF, but they're called add-ons in IVF.
My advice to the general public out there, all those who are thinking they cannot get pregnant because of their age or because of some reasons, they should please come to Elimart Specialist Hospital and give us a chance. Let us see if we can help them or not. I believe that if anyone has any infertility problem, if they reach out to us, we will have solutions to their problem by the grace of the Almighty Allah. And also, if any couple also has tried and failed before, do not give up. IVF is never 100%, but you try until you see your success rate, meaning take home babies. Please, I know it is not easy. Emotionally, it is emotionally affecting a lot of people because you have high expectation, and removing a lot of money is not easy. But if you really ignore the they say how to call it, health is expensive, but try ignorance. Because if you try ignorance and you continue having that mind, set up your mind that my goal is to have a take-home baby, you will make it. You will make it. Trying once doesn't mean you should give up. Trying second time doesn't mean you should give up. Try, because a lot of patients have gone through 6 times, but 6 cycles before they become pregnant. So how about you? You too, you can make it. Just give us a try, and I believe you will make it by the grace of God. Thank you all. Please, if anyone is interested to know our location, we are located here in Senegambia, New Road, opposite Logix petrol station.
I wish everybody well who has gone through successful pregnancy, and then for those who have not experienced pregnancy, you can if you come to LMR Specialist Hospital. Thank you very much.